Hello everyone, welcome back to today's topic of the day. Today we'll be discussing about world's first intranasal vaccine for COVID-19. Now Bharat Biotech's intranasal COVID vaccine BBV154 has been approved by the Union Health Ministry as a booster dose for those above 18 years of age. Bharat Biotech's intranasal COVID-19 vaccine BBV154 is branded as Incovacc. Now Incovacc is a 2-drop nasal vaccine manufactured for active immunization against SARS-CoV-2 virus infection. It is the world's first intranasal vaccine approved for use against COVID-19. Also, it is a recombinant replication deficient adenovirus vectored vaccine with a pre-fusion stabilized spike protein. Earlier, it received approval of the Drugs Controller General of India in November for restricted use in an emergency situation for those above 18 years as a heterologous booster dose. Now let's see who is eligible for this vaccine as a booster shot. It will now be available at private centers as booster shots. It will be introduced on the CoWIN platform. It is likely to be rolled out in the National COVID vaccination program soon. Citizens above the age of 18 are eligible for the booster shot. Those who have been inoculated with Covishield and Covaxin can take it as a heterologous booster dose. In heterologous boosting, a person is injected with a different vaccine from the one that was used for the primary dose. Now, why is it approved as a booster shot? The approval for vaccine comes amid a spurt in COVID cases in China and some other countries. Now, PM Modi ji recently cautioned people against complacency of COVID-19. Now let's see how the nasal vaccines work. A nasal vaccine or nasal spray for COVID-19 is administered to a person through the nose and does not require needles. As COVID-19 is an infectious disease and the virus enters the body through the mucosa, that is wet squeezy tissues that line the nose, mouth, lungs and digestive tract, it makes sense to act against the virus at the entry points, thereby also blocking its spread. Scientists have called this sterilizing immunity, where the virus is prevented from causing infection in the host effectively. In addition to T cells and B cells, nasal vaccines are able to activate another set of immune cells that hang around mucosal tissues. B cells present there make another type of antibody called immunoglobulin A that plays a key role in destroying airway pathogens. Now coming to the benefits of nasal vaccines, nasal COVID vaccine has many benefits over other vaccines that are injected into the muscular system. The nasal route has excellent potential for vaccination due to the organized immune systems of the nasal mucosa. It can create a strong immune response throughout the body, especially in the nose and respiratory tract. It is non-invasive and needle-free. It also eliminates needle-associated risks like injuries and infections. It offers ease of administration since it can be given by any nurse or medical practitioner or even self-administered. Thus, there will not be dependence on trained healthcare workers. It can ensure high compliance. People who are scared of needles, especially the children, can take the vaccine without any fear. It can also lead to massive vaccination as it is very cost-effective as it reduces the cost for needles and syringes. Now let's have a look at the concerns associated with the nasal vaccines. Despite all these advantages, public health experts are divided on the success of the mucosal vaccine for COVID-19. According to some experts, there is very little evidence to back the effectiveness of nasal vaccines so far. Except for some flu vaccines, attempts to deliver vaccines like this have not been very successful. Now this was little bit about the intranasal vaccine. Let's take a practice question from the topic. Consider the following statements. Statement 1. Bharat Biotech's intranasal COVID-19 vaccine Incovacc is the world's first intranasal vaccine approved for use against COVID-19. Statement 2. It is a recombinant replication deficient adenovirus vectored vaccine with a pre-fusion stabilized spike protein. Now, which of the statements given above are correct? You may take a moment and give your answer in the comment section below. Now the correct answer is C. That is, both the statement 1 and 2 are correct. I hope you liked the video and found the information useful. You may also check out our daily current affairs section on our website, and for more such videos, stay tuned to the next IAS YouTube channel.